Welcome to Sports Science. Today we're going to learn identify the basic causes and appearance of sports injuries. We're going to differentiate between the intrinsic and extrinsic traumatic and overuse injuries. We're going to learn about analyze how injuries occur in young participants in sport, list the dangers of an open fracture and understand the complications, and able to apply emergency measures with regard to fractures, and show what precautions must be taken with various degrees of injuries. These are all the things that the teachers say that in the exam booklet. Okay, so let's just jump right into it. First of all, we have sports injuries. So I'm just going to read the basic stuff that she asked, and then I'm going to do another video with where I read everything. So just in case she wants to catch you guys out. Okay, so sports injuries can result from accidents, poor training practices, improper equipment, lack of conditioning, or insufficient warm-up and stretching. So just pause this video and say that over and over and over again. Also from repetitive straining. So accidents, poor training, improper equipment, lack of conditioning, insufficient warm-ups and stretching, and repetitive strain. So a sports injury is an injury that occurs in a participant in sport during the participation or the practicing of his or her sport. The appearance of a sports injury is determined or influenced by what? Well, many things actually, great number of factors, and it cannot be predetermined. You cannot say. It might be somebody sliding, misjudging the slippery of a field and then just sliding and tearing a ligament, or it can be a netball player that doesn't take note of the new surface and then her shoes doesn't move as freely as she's used to on other surfaces, and then she sprains her ankle. So it cannot be determined at all. So there are two types of injuries in sport, two main groups, and they are extrinsic and intrinsic. Now, extrinsic is exactly what it says. It's on the outside, right? And intrinsic is on the inside. That is exactly what what is the English word for this? Like on the outside, you know what I mean. So extrinsic, you must be able to name the differences. So extrinsic is not necessarily unique to that sport. It's outside factors, not from that specific sport. It can occur in other places and not only on that sports field. The force is usually exercised directly from the outside. You see this is a whole theme going on here, like from the outside. It's not necessarily more serious than an intrinsic injury, which we just get by now, and it's caused by incorrect training or technique, or the wrong equipment, or the surface, or the poor environmental conditions. Now, intrinsic is unique to that sport, so it's in that sport, and especially as a result of exertion by the body, so by the internal results of yourself, not by anybody else. And this could be subdivided into acute and chronic injuries. Now, acute injuries is a pain and swelling directly after the injury, and chronic is an inflammation over a very long period of time. So here with the intrinsic, muscles that are not developed equally well will be caused, and a composition of the bones that are a little bit out of line eventually. There's also other two, so that you must be able to identify, and this is traumatic and overexertion. Now, examples of traumatic is like a torn muscle, a strained ligament, a cracked joint, or and overexertion is inflammation of the arteries, tendon, I don't know how to pronounce that, stress fracture of the lower leg, and something like tennis elbow. There was something about that here somewhere. Yeah, here we go. Just all right. Overexertion, just so that you know, is it's very difficult. It occurs when the participation in sport is increased, and then the duration and the intensity of the exercise becomes severe. I think your father might have this. Overexertion injuries usually occur through an overloading or repeated microscopic damage injury to the muscle. All right, let's move on. Next one, I think this is not in the exam, as far as I saw. So see here, divide the injuries into intrinsic, extrinsic, intrinsic, overexertion, or traumatic. So that's definitely something that you can ask. Next we have, at the beginning and the end of each season, players are more prone to injuries. And why is that? You can name 4 things. Give 4 reasons why at the beginning and at the end of the season, players are more prone to injuries. And that's because at the beginning of the season, the fitness level of the players is not up to standard. And because there's not enough exposure to games, or their flexibility is not quite correct. And at the end of the season, they are tired and weary, and their fitness levels drops because they don't spend time on fitness anymore. Remember this one? 7 types of tissue that are strongly affected by injury. And these are, remember to look at your arm, the muscles, the bones, the tendons, the ligaments, the joints, the nerves, and the blood vessels. Now, the muscles, that make up 55% of the total body weight, and the bones, that forms the bony framework of the body to which the muscles are attached. The tendons, or sinews, that attach the muscles to the bones, and the ligaments attach the bony structures together. And the joints make it necessary bone movement possible, and the nerves supply the essential nerve impulses to the various parts of the body, and the blood vessels through which the necessary nutrients are supplied to the tissues, and also through which the waste products after injury are transported away. And that's very cool that the blood vessels can do that. There are also a few organs in the body that can be damaged by the injury. And what are they? It's the skin, the brain, the internal organs, the sex organs, and the eyes and teeth. So for the skin, it can tear, it can be cut, it can be burnt. For the brain, it's protected by the skull, but it's sensitive to hard knocks, so you can get a concussion. That's why cyclists wear helmets. The internal organs such as the liver, the kidneys, the heart, and the pancreas. A hard knock to the liver can actually cause bleeding, internal bleeding, and it's very extremely dangerous. The sex organs. This is why protective gear must be worn in various sports, especially for men. And the eyes and the teeth, well, you can lose an eye or a tooth if you don't wear any. For rugby players, specifically at the senior level, must wear a mouth guard. Very good. Good thing to do. During serious injuries, 3 changes take place in the soft tissue. Now, soft tissue, if you remember correctly, is injury suffered by the muscles and tendons during partition. So, muscles and tendons, that's the soft tissue. So what happens to this 3 changes that take place in the soft tissue during a serious injury is the loss of tissue or evenness in the tissue, the tearing of the surrounding small blood vessels, and the prominent inflammation with redness and swelling and pain. Now, if the recuperation period is longer or more difficult for serious injuries, in some cases it can also cause permanent scar tissues, known as connective tissue. Now, this scar tissue can result in various things, and this was in the exam last time, so please learn this. 4 things. The tissue lose elasticity. The skin, there's some skin discoloration. It inhibits the exercise capability or the movement, and that's definitely not normal. And then the instability of the joint can occur. Okay, when a broken bone sticks through the skin, that is called an open fracture or a compound fracture. Now, there are dangers of open fractures, and this is very important to learn because this was also in the test last time. So the dangers of an open fracture is, remember it's open, there's a bone sticking out. So infections in the wound or even in the bone marrow, bleeding because it's open, retarded recovery because it's open, so it will be difficult to heal. And then germs can go into the bloodstream and cause blood poisoning because all of this is open. Very, very dangerous. What are the symptoms that are present with a fracture? Now, there's pain and tenderness. If you remember, we looked at our foot for this. So pain and tenderness, there's swelling and bruising, bleeding beneath the skin that makes the swelling even worse, restriction of movement. You can't move the foot. Your foot is skew. It's deformed, the bone structure. Maybe it's even shorter. If you broke a leg, then your leg is going to be shorter. The shortening of the bone structure. And the irregular feeling. So you will maybe feel that there's even a break there. The irregular feeling of bone structure. And the person will most likely be in a hectic state of shock. What are the complications that are present in such fracture? Very important question. The tissue and organs that are situated near the broken bone can be damaged. So, like for a rib, it can actually puncture a lung. The bones can battle to heal and may be necessary to join them with pins and screws that does not rust. And the bones can heal incorrectly or skew, as a result, impair the proper functioning of the bone. So you might grow it weird. And tight bandages or plaster casts can impair the blood flow to the bone and muscle, and that leads to rotting of the bone, and that is known as gangrene. Another important question, what emergency measures must be followed? Now remember, we said somebody is hurt on a field. What happens here? You get the necessary medical and paramedic personnel. You stabilize the person that is on the field. If it has open wound, you cover that with some gauze or a bandage. You keep that beautiful limb stable. Do not move it. The limb must be elevated so the blood can flow out and the injured limb swelling will decrease. And you place the limb carefully in a natural position, but don't push it into that position. When it's on the field, you carry the person from the field. So treat the bleeding. If it's an open wound, treat the person for shock, and then call the hospital and take the person to the hospital. And then last two things. There are especially two types of muscle tears. Remember we forgot this last time? There's distraction and compression. So distraction is caused when the muscle is overexerted and overloaded. So distraction, let's think about it this way. If there's a truck and the driver of the truck is distracted, and then they overload the truck accidentally because he didn't see what was happening. So distraction is when a muscle is overexerted or overloaded. For instance, sprinting or jumping or something like that. And compression, you remember, is a direct knock on the muscle. This is when you run into somebody or opponent's thigh. This is also important. Last one, muscle injuries that occur in the lower limbs are the following. In the groin, upper and front thigh, lower part of the back thigh muscle. So upper thigh, back thigh, lower front thigh, and back thigh, upper thigh, lower thigh, front thigh, quadriceps, and the calf muscle, which you nearly forgot last time and luckily remembered. The Description of what does ligaments do? They're the connective tissue. They run across the joints. They join the bands together. They regulate the movement and they keep